Assalamualaikum warahmatullahi wabarakatuh. We are from Group 4 and the topic that we are going to present is sexual ethics on premarital sex, contraceptive and abortion. Okay, so my name is Marini and I'm going to talk for the introduction part. So I'm going to explain first about what is sexual ethics. Basically, sexual ethics is the branch of philosophy that explores the moral obligation, permissibility or impermissibility of sexual activity. So, what is the purpose of sex? For a long time, it has been known as a fundamental value in the reproduction system. And when we talk about sex, it is usually associated with marriage. And marriage is the basis of building a family and also producing generations of humans. Okay, so apabila seks ni berlaku dalam konteks marriage dan disebabkan melalui marriage ni keturunan berkembang biak, so dia telah memenuhi tujuan asal seks tadi iaitu untuk memenuhi reproduction system. So dengan melalui situasi ni, it is clear that benda ni adalah normal. However, when activities such as premarital sex, contraceptive and abortion were brought into the discussion about sexual behavior, various views were generated with justifications on whether it is morally acceptable or morally wrong. Kenapa? Sebab benda-benda ni dah jadi lari daripada apa yang kita normally understand about sex, iaitu seks yang berlaku dalam konteks marriage dan juga untuk memenuhi reproduction system. So macam premarital sex, it is done between couples that are not tied to the marriage knot, and contraceptive and abortion defeat the true purpose of sex, which is to reproduce. Okay, so maybe some of you are wondering, sejak bila sebenarnya premarital sex, contraceptive and abortion dinormalisasikan dalam kalangan masyarakat. So, I'm going to introduce to you sexual revolution. Okay, so sexual revolution telah bermula di United States of America pada tahun 1960-an. Kemudian dia merebak ke negara-negara western yang lain dan kemudian barulah secara globally. So what is sexual revolution? It is a huge reformation on the public's perspectives and practices regarding sexuality and sexual behavior. And it promotes freedom for individuals in making decisions involving their own bodies. So basically, diorang nakkan more freedom on expressing their sexual desires, basically sexual liberation. And also, mesti pernah dengarkan phrase my body, my right. So itulah apa yang sexual revolution wanted to achieve. And tambahan lagi, masa ni the western countries saw the development of individualization, democratization and secularization, in which the younger generation especially did not want to be guided by the institutions of the past. And masa ni pun media macam dah become more open dengan anything related to sex. Benda-benda yang dianggap macam tak berapa sopan dah mula dianggap sebagai benda yang normal.
Assalamualaikum warahmatullahi wabarakatuh. My name is Aisyah and I'll be talking about premarital sex. Now let's start with the definition. Premarital sex means premarital sex means sexual intercourse before marriage, whether marriage with that sexual partner or anyone else. Now, that means a sexual intercourse is done between two people that are not married. Basically, that's what it means. There are different types of sexual relationships. There are casual sex, there are open relationships, and polyamorous relationships. Now, some may not have heard of open relationships or polyamorous relationships, so let me tell you. Open relationship is when maybe two people who are maybe married, that they are open if their spouse wants to have sexual relationships with another person that is outside the marriage. Now, polyamorous relationship is also kind of the same. However, polyamorous relationship is not always about sex. It also involves like emotional connection and seek more than just sexual urges. Okay, that's the difference. Now, some of the causes of why premarital sexual relationships happen is because since we are influenced by our social norms and family values. When someone has freedom without interference by their parents, without from their schools or churches, or maybe in our society from Islamic influences. So maybe before that they feel like terlampau decontrolled by all these other adults. So when they get out of that environment, they tend to follow their own sexual desires, and maybe some people see it as a way to show off to their friends if you do premarital sex. Next is exposure to pornography. Now, based on a survey, there are actually 22% students who are sexually active said that they were influenced by their exposure to pornography, according to Dr. Wan Aziza. Now, next is delay of marriage. It's also one of the causes, because because of socio-economic reasons, women tend to delay their marriage in order to pursue education, which is very common nowadays, since both men and women are expected to have income, right? So that is also because they put off their marriage, they don't really feel the need to get married first to be able to have sexual relationships. Now, next is lack of friendship-based relationships between parents and children. Now, this includes lack of love-based home environment, maybe because there is too much prohibition, there's too much command from the parents. Maybe the parents like to humiliate their kids a lot, and which causes their children to feel inferior, lonely, hopeless, and ostracized by other people, which causes them to seek for love and affection from other people. Alright, next cause is a liberal and permissive society. And another one is social networks, media and communication technologies, as well as socio-economic development, similar to what I already said just now. And last of all is confidence in birth control. So some people, since they already have birth control, they kind of feel like, I wouldn't get pregnant anyway, so might as well just do sexual intercourse with another person. So now what is the effect of premarital sex? First is sexually transmitted disease like herpes, HIV, AIDS. HIV and AIDS are like, it's non-curable, it's very serious, and it can happen because of maybe if the other sexual partner did not get checked, or maybe they lied, they actually got checked and they tested positive for STD, but they lied to their sexual partner, so that can be transmitted. There's actually a survey, a research done before, that recorded 10% of the respondents, they believe that it is not possible for them to acquire STDs regardless of the number of their sexual partners, which is a total ignorance. Okay, well, next effect is teen pregnancy. Obviously, you will get pregnant if you don't do safe sex. Actually, even sometimes when you do use condom, you can still get pregnant. And then when an unwanted pregnancy happens, sometimes the parent, akhirnya yang the mak dia will be a single parent. And this will cause a lot of stress for them, especially if they're young, especially if they lack support. It's going to affect their psychological health, their physical health, which is incredibly sad. Okay, now next effect is baby dumping. Obviously, Malaysia. A lot of this in Malaysia. A lot of this in Malaysia. There's actually 4,992 illegitimate children were born to young mothers aged 18 and below in 2017 in Malaysia. Alright, and next effect is increase of sexual assault. You know why? Because there was a survey by Malaysian Youth Sexual and Reproductive Health, and it reveals that 34% of respondents seem to think that sexual consent is not important. And one respondent said many teenage girls are having sex before marriage because they do not know how to say no or how they should react when pressured. So yes, it's going to increase a lot of raping cases, which is terrible. Next is the effect on the woman involved in premarital sex, the side effects of contraceptives. Contraceptives can actually make someone get headaches, moodiness, abdominal pain, and menstrual irregularities, which is so stressful. And next is also going to cause emotional stress for the individuals, because research suggests that emotional stress caused due to breakup where partners were sexually intimate can be a cause for depression. Yelah, sebab dah like very intimate with someone, you're emotionally involved, you're physically involved, and then that thing doesn't happen. Of course, it's gonna ruin your self-esteem, your happiness, and then people are gonna gossip about you and stuff. So that is terrible. So yeah, when a breakup happens, that those individuals are gonna be very, very affected. Now next, well, generally speaking, if we do not talk from an Islamic point of view, from a religious point of view, premarital sex isn't exactly that immoral, but if it is not consensual, which means there are sexual assaults involved, if there is cheating involved, adultery, if there's prostitution, if there's grooming, if there's victims involved, then of course I think we can all agree that it is immoral. Now, what are the risks of premarital sex? There's going to be sex addiction, there's going to be children with emotional and behavioral problems, children which are born out of wedlock, there's going to be health issues like I mentioned earlier, and also research has said that people who do premarital sex may experience lower levels of relationship satisfaction and marital dissolution and stability. Now, if you have with children and you want to prevent premarital sex, what can you do? You can build strong relationship with your children. You know why? Because we can make them feel less alone, we can make them feel loved, we can let them know what a healthy relationship is, and when they understand what a healthy relationship is, they will not try to follow their sexual urges and lust and use that as the main driving factor to be and stay in a relationship. Okay, and also there is always high demands in grand wedding ceremonies like akad nikah, hantaran, all those kind of stuff will be very stressful for young people, and that might make them want to just ignore marriage and just go on with premarital sex because it's too much pressure, it's too much commitment. That we should also lessen the pressure on marriage and on wedding ceremonies. Next is we should also educate on the responsibilities of marriage and partnership to our children, and also educate them on consent, on how to respect your body and think of the consequences of your actions. I want to add, teens that grow up in two-parent families are more likely to delay sexual activity because they are more monitored. Okay, closely monitored, so they will delay the sexual activities. Now, last of all is about alcohol, because alcohol can actually increase someone's sexual desire. Okay, that is all from me. Thank you very much for listening. Goodbye. Assalamualaikum.
Hello, my name is Nurul, and for my part, I will be explaining about contraceptives. So let's begin. First of all, I will explain the definition. There are actually many names for contraceptives. Some people call it birth control, other people call it contraception and fertility control. Does not matter, whatever you want to call it. The definition for all these words are the same, which is it is a method or device used to prevent pregnancies. Or in other words, is that when two people, one male and one female, doesn't matter whether they are married or not married, when they have sexual intercourse, the natural consequences of the sexual intercourse is pregnancy, right? Now, with contraceptive, they can actually prevent the pregnancy. So that is what contraceptive is all about, to prevent pregnancy. Historically, birth control has been used since ancient times, but effective and safe method of birth control only became available in the 20th century. planning make available and use birth control is called family planning. Moving on to the common method or instrument of contraception and how they work. There are two types of common method: physical barrier, hormonal birth control. Physical barrier actively block the sperm from the egg, and a common type of physical barrier is actually condom, which captures the ejaculated semen and physically preventing sperm from entering the uterus. And condom is the only readily available male birth control. For hormonal birth control, a contraceptive implant is a type of hormonal birth control. In United States, it's sold under the brand name Nexplanon. It was previously available for the name of Implanon, but implant itself is a very small plastic rod about the size of a matchstick. I will show in the next slides. A doctor insert into the upper arm right under the skin, and the implant slowly release a progestin hormone called etonogestrel into the body. Progestin prevents pregnancy by blocking the release of eggs from the ovaries. It also thickens cervical mucus to prevent sperm from entering the uterus. Implants used must be removed after 3 years. So, with the explanation, these are the examples with picture. This one is condom, commonly used, commonly known. And this one is the one that I mentioned before, the Nexplanon, hormonal birth control. Moving on. So in these modern days, there are tons of options such as IUD, hormonal ring, or tracking your cycle, and the list goes on and on. And here we can see that there are classification which is very effective, okay, and least effective. Moving on. Now the question, is it 100% effective? The answer is no. They may not be 100% workout. For example, like this one, male condom, safe sex are only 98% effective, which means even with this protection, there are still chances and possibilities of pregnancies. And the decision about what kind of birth control option to use is extremely personal, which is it really depends on the individual or the couples. Next, so why contraceptives? There are many positive reasons and benefits which make people opt for contraceptives. First of all, family planning. They want to plan the family. And next is prevent unplanned pregnancies and reduce unsafe abortion from unintended pregnancies. It says here an estimated 20 million unsafe abortions take place each year. So family planning can prevent many of these tragic deaths by reducing the number of unintended pregnancy with a higher risk of pregnancy complication and unsafe abortions. And it also reduces adolescent pregnancies and slowing population growth. Next. Alright, so next is moral view. Okay, for my part, I will briefly state few moral views on the topic of contraception, but later on the other part of this video, Marini will conclude our final thoughts and moral judgment regarding this issue. So, some people argue that contraceptive is morally wrong. Their argument is that, number one, contraception is anti-life, and contraception leads to immoral behavior. So this is the relevant point that they made. I will explain. They say that life is a fundamental good. It is a good thing. So therefore, those who use contraception are engaged in an intentionally anti-life act because they intend to prevent a new life coming into being. they therefore have a bad intention, and it is always morally wrong to do something with a bad intention. Therefore, with this argument, they conclude that contraception is morally wrong. The next argument is contraception leads to immoral behavior. They say that contraception makes it easy for people to have sex outside marriage, and it leads to widespread sexual immorality. And it also said that contraception allow people, even married people, to have sex purely for enjoyment, and therefore they think that contraception is morally wrong. So that one is for those who say that it is morally wrong. Meanwhile, this one is the one that say it is right to allow people to practice birth control because of these two reasons. The first argument, it says that it is right because it prevents the because it prevents the conception of unwanted children and so reduce the number of possible abortions. And the second argument, family-wise, it says that it enables couples to enjoy the unitive function of sexual without being anxious about conceiving a child, and it also helps to avoid having more children than they want. Alright, so these are two claims for those who say that contraception is right. So that's all for my part. I will pass the floor to Farah. Thank you.
Hi, Assalamualaikum. My name is Farah Mehtab, and today I will be presenting on the topic of abortion. Okay, so what is abortion? Abortion is an induced miscarriage. It is a procedure to end a pregnancy. It uses medicine or surgery to remove the fetus from the uterus. Okay, so the procedure has to be done by licensed healthcare professional. When properly done, it is one of the most safest procedures in medicine. It used to be very dangerous, but now because of the development of technology and medicine, it has become one of the safest. It's safe to do. Right. So the methods of abortion, there are two: medicine and surgical. Surgical abortion, historically people would sterilize instruments needed for manual removal of the fetus from the uterus. So this is to avoid risk of internal infection, injury, or even death. Since the introduction of the vacuum suction, it is now considered one of the safest procedures in medicine as well, surgical abortion. So there are two types of vacuums: manual vacuum aspiration (MVA) and electric vacuum aspiration (EVA). Manual MVA does not need electricity. You have to do it manually. However, EVA needs electricity to use. Okay. After the second trimester, medical professionals prefer to use the EVA method because it is easier and safer. If surgical abortion is done within the first trimester of a pregnancy, it's very effective and very safe. After that, the risk of complications are a bit higher. The next method is medical abortion. It is a non-surgical method for women below 63 days or 9 weeks of gestation. So when you do medical abortion, it is above 97% effective and extremely safe. There are two medications that are required to do this: mifepristone, and which prevents further growth of the fetus. It stops its development, and misoprostol is for expulsion of the fetus out of the uterus, to remove it. Right. However, if you take medical abortion, the side effects will obviously be pain, nausea, vomiting, sometimes diarrhea, and there is also fever. Next is why women want abortion. Typically, women want abortion if the child is a product of rape or incest. If the child dies before it comes to term, it dies in the womb, or the child is proven to have some sort of deformity or an illness that is terminal. Also, women would want an abortion if they realize that they are not able to provide and care for the child to their full extent, because maybe it interferes with their education and career. Maybe they don't have enough finances, they have limited resources, and maybe they have other responsibilities and commitments that does not allow them to focus on something that is very fragile and important, right? They prefer abortion than to give birth to a child and to give it up for adoption, because it is emotionally painful for them to give up their own child instead of just aborting the child before they form a bond with the child. Alright. And lastly, abortion is also a means of birth control, especially in states or countries where there is a limit to how many children you have, right? So if they cannot exceed their limit. Okay. So in the topic of abortion, I think you've all heard of pro-choice and pro-life. Okay, pro-choice is the belief that everyone has the basic human right to decide whether they want to have a child or not. Pro-life, people who are pro-life, they oppose abortion in defense of human life. However, the only life that they are concerned with is the life of the fetus, and even that only during the pregnancy. After the pregnancy, they don't care much for what happens to the child after that, or during the pregnancy, what about the mother's life and health. They don't care much about that. Alright, and there's also pro-reproductive rights and anti-abortion. As it says itself, I think it's self-explanatory. Pro-reproductive rights means you support laws that allow people to have access to full range of reproductive health care. So this includes safe and legal abortion. So anti-abortion people who want abortion to be illegal, totally prohibited. They believe that they don't believe that pregnant people should be able to choose abortion under any circumstances. Does abortion harm or help women? Legal abortion means that the law recognizes a woman as a person. She has her own her rights as a woman, her rights as a human being, basic human rights, the rights to take care of herself, the right to have a choice. Also, legalizing abortion means that doctors no longer need to or cannot deny treatment to a pregnant woman. Usually doctors will either withhold treatment, or they won't treat a pregnant woman until after she gives birth, then they give treatment to her. Okay. Also, with abortion, women can have a more sexual life without risking their future, like their career, their responsibilities and commitments and things like that, because they don't have to worry about having a baby. Also, with abortion, women can postpone childbearing and parenthood. If a woman feels that she is not ready or does not have the resources to take care of a child or to commit herself to parenthood, she can choose abortion so that she can postpone it. Okay. Although, if there is abortion, women will obviously increase in sexual activities due to them thinking they have a safety net. So this might create some kind of irresponsible adults, women and men. Women, because they think if they get pregnant, they can just get rid of the baby. Men, they think they can sleep with women, and if the woman gets pregnant, they can just tell her to get rid of the baby, things like that. And lastly, if abortion is normalized, society might become so desensitized towards abortion, it might think it becomes like a simple solution to childbearing problems. Or you don't want to have a child, have an abortion, or things like this. Abortion, it's a normal thing anymore, which is not actually very good. What is the legal status of abortion? There are 5 categories to abortion. Category 1, prohibited altogether. 2, to save a woman's life. 3, to preserve health. 4 is for broad social and economical grounds. And lastly, on request means you go to the clinic, you say, I want to have an abortion. Okay, jalan. So in Malaysia, actually our legal status of abortion is category 3, to preserve health of mother. So in China, they need some form of childbirth control, because there are too many people there. It's also the same in India, but India is more towards category 4. Alright, so the majority of women in Asia live under liberal abortion laws. Alright. Next, unsafe abortion. What is unsafe abortion? Unsafe abortion is the abortion procedure done by someone that is lacking the necessary skills or qualification to do the abortion. So or the environment there is lacking in minimal medical standards. So is it hygienic? Is the equipment up to date? Maybe it's not. So if it is not up to date, if it's not to the standards, so it is unsafe abortion, and it will have risks to it. So the most common complications when women have unsafe abortion are: 1, incomplete abortion, excessive blood loss, and infection. Excessive blood loss and infection can be fatal. According to the World Health Organization, every year 47,000 women die because of unsafe abortion, and millions of others become temporarily or permanently disabled because of the unsafe abortion. But padahal unsafe abortion is entirely preventable. This unsafe abortion happens because of unmet need for family planning, contraceptive failure, so there's no birth control, a lack of information about birth control, and restricted access to safe abortion services. Is the human fetus a person? According to law, human right of life begins sometime after birth. So technically, killing a fetus before birth does not violate those rights. So it is not possible to damage a fetus or newborn by preventing them of developing in life and becoming a person, because they have not yet become such a person. They just exist. They do not yet have a morally relevant sense to themselves. Okay, so also a fetus is legally classified as child at 24 weeks. After 24 weeks, all legal formalities are then applied. Also, our Rasulullah has said that as regards to your creation, every one of you is collected in the womb of his mother for the first 40 days, and then he becomes a clod for another 40 days, and then a piece of flesh for another 40 days. Then Allah subhanahu wa ta'ala sends an angel to write forwards. He writes his deeds, time of death, means of his livelihood, and whether he will be wretched or blessed in the hereafter. Then the soul is breathed into the body. So after how at least 80 days or 160 days, then only the soul is breathed into the body. Before that, there's no soul. So does it count as a person then? In Islam, if a fetus is below 4 months of age in gestation period and it dies, it need not follow the typical human funeral rites. It need not be washed or given prayer to. No name is required. After 4 months, if it shows signs of life by then it must follow typical procedures of funeral rites. If there is visible limb formations, it must be bathed and shrouded, but informally. It does not need to be tied specifically. Just wrap the baby in the white cloth. It needs to be given name and buried. However, salat janazah is not needed. Lastly, what is Islam's perspective of abortion? Abortion is only allowed if the continuation of the pregnancy endangers the life and health of the mother, or if there is proven serious anomaly or illness to the fetus. Performance of abortion should be done before 120 days from the start of conception, which is considered time of ensoulment according to the hadith. However, if both life and health of the expectant mother are endangered with the continuation of the pregnancy even after the 120 days, then the abortion can be performed at any time. It's alright because the mother's life is important. Thank you for listening to my presentation. I'll pass it on to my friend now.
Okay, so before we proceed with our moral judgment on premarital sex, contraceptive, and abortion, let us take a look into some moral theories that have touched on sexual ethics. So there are 4 theories that I have found. The first one is the Stand Aquinas and natural law theories. According to them, true end of sex is procreation, and so sex is only pleasurable to fulfill this end. Kiranya macam yang the normal definition of sex that I mentioned earlier in this video. And then utilitarianism. According to utilitarianism, sex can be morally acceptable or vice versa, depending on the consequences of the action. So according to this theory, sex can be morally acceptable bila mana it brings pleasure to those involved in the act. So macam contoh lah, adultery. It can be considered as morally acceptable actually kalau kalau that act boleh membawa kepuasan kepada those yang involved. So tak kira lah dengan siapa pun the sexual act is done with, as long as it brings pleasure to both to everyone involved in that act, so it is considered as morally acceptable. Tapi dia jadi morally unacceptable macam tadilah bila mana dia membawa harm atau pain kepada someone yang involved in that act lah. Contohnya macam kalau rape. So sebab rape tu kan victim of the rape dia akan jadi trauma kan because of that action. So sebab itulah rape dalam utilitarianism is considered as morally unacceptable. Okay, so Kant's perspective on sex, according to him, he believes that sex is only permissible within the context of heterosexual, lifelong, and monogamous marriage. He is also considered as a sexual pessimist. Sexual pessimist ni, diorang percaya yang apabila kita bertindak hanya berdasarkan nafsu, dia dikira sebagai satu tindakan yang tak bermaruah. Sebab it might threaten our proper moral life. Kant believes that in premarital sex, the sex is only about fulfilling sexual desire and pleasure, which means treating the other person's body only as an object. So, Kant ni pula dia percaya treating each other as a whole person is considered as moral. And dalam marriage, sex is beyond treating each other's body as an object of indulgence and fulfilling the sexual desire and pleasure. So, sebab itulah, Kant dia against premarital sex, tapi kalau seks tu dalam konteks marriage, it is permissible. And the last theory is the virtue theory. According to this theory, it is about responding to things in the right way, at the right time, with the right reason, to the right extent. So basically, kita sepatutnya bertindak secara rasional. The virtue theory is also aligned with Aristotle's golden mean. Sebab dalam Aristotle's golden mean, temperance towards our appetite and desire is the virtue. And kalau dekat deficiency side of temperance adalah self-indulgence, which is lacking self-control. And kalau terlalu excessive pula temperance dia adalah insensibility, which is being indifferent. So yang sepatutnya kita terap adalah the sifat of temperance. Okay, so our moral judgment for premarital sex, technically we think it is not morally wrong. Okay, before anyone gets triggered, the reason being that it does not harm anyone involved, especially if safe sex is practiced. And also, both parties consented to it, which is both of them are aware of what they are doing and the consequences of their action. That's why they are practicing safe sex. And this is also supported by the utilitarianism theory, because so dalam teori tu kan dia kata kalau sesuatu act tu brings pleasure, then it is considered as morally acceptable. However, we also think that it can also be morally unacceptable. Why? Sebab disebabkan normalization of premarital sex, dia akan membentuk satu golongan masyarakat yang hidup hanya berlandaskan nafsu. And bila diorang praktis self-sex, dia maksudnya memang betul-betul seks tu hanya dilakukan dengan tujuan untuk memenuhi diorang punya sexual desire. Dan bukan lagi untuk bukan lagi untuk memenuhi tujuan asal seks tadi, iaitu untuk fulfill the reproduction process. Our view is also supported by the Kant's theory tadi. So they can believe acting upon our sexual desires and impulses is considered as an undignified act. And also Aristotle's golden mean, sebab inability to control ourselves from acting irrationally when dealing with our sexual desires is on the deficiency end of temperance, which is the self-indulgent trait tadi. So kita kan sepatutnya bertindak secara rasional, which is kita sepatutnya kena ada temperance towards our sexual desires. Okay, for those couples yang get involved in premarital sex, diorang sepatutnya aware yang safe sex is not 100% safe. So kadang-kadang boleh terjadi juga unwanted pregnancy. So bila terjadi unwanted pregnancy, these couples will be facing with two different options. First is to do abortion, which I will elaborate later when talking about moral judgment for abortion, and also to keep the child. So I'm just going to assume that the couples will keep and raise the child, atau the woman. I'm not going to touch on those yang mungkin akan bagi baby dekat orang lain ke, ataupun dekat macam punya case yang buang anak tu semua, sebab I'm trying not to take too much time. So let's just assume that the couples or the woman will keep the child. So kalau katalah dia nak keep the child, more problems will arise. Salah satunya adalah the psychological effects that can happen to the child, to the mother or both. The psychological effects to the child ni, sebab macam dekat Malaysia pun still ada masyarakat yang pandang serong terhadap anak luar nikah, right? So walaupun the child gets all support from people, from their family ke, tapi kalau macam asyik kena pandang serong dengan masyarakat, mestilah sedikit sebanyak dia akan effect juga dekat child's punya mental health. So kalau dekat mother tu pula, biasanya society dia tak akan lupa tau. Dia susah. Kalau benda-benda macam ni, diorang akan sentiasa being judgmental towards the mother. So still akan effect juga dekat mother punya mental health. And then another problem is nasab keturunan lah. Sebab kalau dalam hukum Islam pun kita tahu kan, kalau anak luar nikah, anak tu dikira bukan mahram dengan bapa kandung dia, and so the father does not have the rights as a guardian, and also the child does not have the right to inheritance. Mungkin for some people benda ni macam setakat tak dapat warisihan tu saka dia, macam tak ada benda sangat, but for some people it is important. So macam kalau anak perempuan tu, bila dia nak bernikah nanti, proses nak bernikah tu dia tak boleh lah guna bapa kandung dia as jurunikah, right? Dia kena cari, dia guna wali hakim, right? And although macam kalau tak silap, boleh je anak tu dia dijadikan sah taraf kalau dia lahir 6 bulan selepas the parents got married. Tapi itulah masalahnya, kalau lelaki tu nak bertanggungjawab lah. So kalau kata lelaki tu tak nak bertanggungjawab, tu dah jadi problem lain pula kan. So sebab itulah based on this effect, disebabkan macam lagi banyak negative effect, kita orang decided that premarital sex is morally unacceptable. It is not technically it is not morally wrong, sebab kita orang sebab saya rasa ada beza antara morally wrong dengan morally unacceptable. Morally wrong bila mana benda tu memang terang-terang salah. Macam killing, right? Tapi premarital sex on its own, dia tak morally wrong. Tapi bila mana ada consequences yang negatif, we decided that it is morally unacceptable. Okay, untuk contraceptive pula, generally kita orang tak ada apa-apa against pun. Tak ada apa-apa against contraceptive. Kita orang rasa it is morally acceptable kalau ada strong reasons. Macam ada setengah parents, ada setengah couple, diorang memang tak mentally and financially prepared to raise a kid. So daripada diorang raise a kid, lepas tu nanti buatkan the child suffer, lebih baik diorang elakkan benda tu kan, by using contraceptive. And also it can be a way to reduce poverty in nations dealing with it due to overpopulation. Tapi for us, the only downside to this is it might lead to the increase of premarital sex. Sebab the couple dah tak perlu risau lagi dengan unwanted pregnancy, right? So dia macam tak salah. I mean, kalau dia guna contraceptive, at least dia macam boleh kurangkan risiko, kurangkan impact negatif yang lain-lain tu kan. But still, disebabkan kita orang rasa kalau kita normalisasikan premarital sex ni, dia macam membentuk masyarakat yang hidup berlandaskan nafsu. So bila mana contraceptive ni digunakan untuk this kind of people, so kami merasakan bahawa benda ni akan jadi morally unacceptable. Tapi secara overall kita orang tak rasa benda ni salah pun. Okay, lastly abortion, we are more inclined towards pro-choice. Sama juga macam contraceptive tadi, kita orang rasa it is morally acceptable kalau ada strong reasons to choose abortion. Macam kalau kata the mother was a rape victim, sebab benda tu jadi trauma. So ada kemungkinan the mother tak boleh nak accept the child. So daripada nanti sekarang akan jadi psychological effect pula dekat child tu, better lah kalau the mother just abort, just terminate the pregnancy. And also kalau the pregnancy threatens the mother's or the child's life. Macam sekarang ni kita dengan advanced technology nowadays, doctors dah boleh detect kalau macam the child tu ada disease macam Down syndrome disease. So the mother will be given an option sama ada nak teruskan pregnancy ataupun abort. And so kita orang tak rasa benda ni salah pun kalau the mother chooses to do abortion in order to protect herself ataupun the child's life. Tapi it can also be morally unacceptable again, sebabnya ada golongan yang mungkin akan exploit the fact that they can choose to do abortion anytime unwanted pregnancy happens. So kami merasakan bahawa dia akan melahirkan masyarakat satu golongan yang irresponsible and selfish. But I mean, dia tak salah kalau nak buat abortion. Cuma macam disebabkan ada setengah golongan ni mungkin akan rasa macam, alah kalau mengandung pun gugurkan je lah. Lepas tu nanti sekarang buat lagi, lepas tu gugurkan lagi. So macam tu je lah putarannya. So dia memang kiranya berbalik kepada point asal kenapa kita orang rasa premarital sex ni unacceptable. Sebabnya rasa macam dia akan melahirkan masyarakat yang memang hidup hanya berlandaskan nafsu. So only under these circumstances lah yang kita orang rasa macam benda ni akan jadi morally unacceptable. So that's all from us. Thank you.